Thank you again. For those who are new members, and I've mentioned it for those in the public, in 2004.
You're good.
Okay. In 2004, patients were not being reimbursed when acupuncturists were using the code manual therapy. Manual therapy is a medical term that describes what at that time was called Oriental massage. It has since changed to the word Asian massage. But at that time, the acupuncture board discussed this at length, and then began sending letters to insurance companies, letting them know that after discussion, what you're calling, or what we call Oriental massage, or now Asian massage, is a form of manual therapy, and it is consistent within our scope of practice. I actually received a letter from an insurance company that was sent to my patient, telling my patient that I was beyond my scope of practice. And that's where the acupuncture board stepped in. So since 2004, the acupuncture board has been sending many of the boards have been sending letters to insurance companies, letting them know that manual therapy is part of our scope. Previously, acupuncture associations have introduced legislation to change the wording to manual therapy. It successfully made it through both houses and was vetoed by Governor Schwarzenegger upon receiving over 500 letters from the physical therapists opposing us using that term. So I'll give you a little bit of some background and then what we would like. Massage is the use of rhythmically applied pressures to the skin, soft tissues of the body. Massage is used to reduce tension, anxiety, stress, and promote overall circulation, relaxation, and flexibility. The level of education for someone doing massage, they now have a massage board, and so there are now standards of what massage is. Manual therapy is something that is performed by a much higher level of education, whether it's a medical doctor, an osteopath, chiropractor, physical therapists, athletic trainers, and acupuncturists. This is the term that we use. Manual therapy is the application of hands-on techniques to the body tissues with the intent to therapeutically access and treat. Through proper assessment of the involved body structures, the therapist can utilize manual therapy techniques to enhance the healing process and correct positional faults of the irritated tissue. Some manual therapy techniques utilized by therapists include soft tissue mobilization, myofascial release, strain, counter strain, muscle energy techniques, joint mobilization, and manipulations with movement. This is what we call tuing ha. That's an overall description of that. Also, things that would fall into the category that would help educate the public is something we call gua sha, which has been now renamed by the physical therapist and the chiropractor, so now has a new name. So it's been called gua sha for thousands of years, and now they have a new term for that as well. Anybody know what the name of that is?
Graston technique.
Graston technique. And cupping, you know what cupping is. My grandmother used to do cupping with jelly jars on me. But cupping is now called myofascial decompression. There is not yet a CPT code for that, but that's what it's called. A CPT code is the current procedural terminology. There is a CPT code for manual therapy. There is no CPT code for Asian massage. When you speak to a other healthcare provider, whether it's a medical doctor or anyone else, if you said, I'm doing Asian massage, they're like, I don't know what that is. And as I pointed out to the board, when you Google Asian massage, it's quite problematic. It just has pictures of naked women and is promoting something that we don't want associated with our profession. And we've been after the board to support the changes. When we as a profession, introduced legislation that went to the governor on 2 different occasions, the board's position was in support. So when CalATMA goes and introduces legislation, hopefully next year, we are hoping that the board will be in support of this. And we also think that it goes broader because it will cover cupping and washaw and tuina. So terms that are ancient and have been around for thousands of years, we'll be using modern current medical terminology to discuss what we are. It's bringing us into the modern world with the language that we use to describe what we do to, whether it's third-party insurance companies or to patients that they know what we do, or in my case, to healthcare providers. It's a very important term to talk about what it is that you do. And when I write a medical report to the doctors from the various hospitals that refer me patients, that's what I'm writing in my report. We did acupuncture and manual therapy. They understand what I'm talking about. And if I said acupuncture, manual therapy, including myofascial decompression, they're not quite sure, but they understand technically what it means. And then I'll talk about cupping, and they'll say, oh yeah, my grandmother did that to me. So that's what we're doing. What we want to do is we're going to define manual therapy. We're going to codify manual therapy in statute, and we would love to have your support on this. Our next steps are, as an association, on the issues that we brought forth today in our discussion, both the dry needling and manual therapy, are to continue our conversations with the legislature, Assemblyman Lowe, who's the chair of the Assembly Business and Professions Committee, and on the other side, in the Senate, to work with them as well, to inform them, because they changed language, and as I pointed out before, it's consistent with the Little Hoover report that the board work to work with the legislature on the language so that it gives a better understanding to the public and to all stakeholders on what it is that we do. So we want to collaborate with the board, with the legislature, and nationally, CalATMA is working with the ASA, the American Association of Acupuncture, and so what I'm discussing today is consistent with the trend in acupuncture, and it's incumbent upon California, as David said, to be the leader. When Asian medicine came to America, it started in California. This is the seed of Asian medicine in America, and with such a fine board and a united association and a legislature that's listening to us, now is the greatest opportunity of my life to really serve the public, protect the public, and go forward in a very positive way. So we look forward to working with you on this issue, and we really appreciate the time that you would allow us to discuss this. Any questions?